Let's stand for the invocation with Chaplain John Gerhardt.
Thank you, Dr. Chairman Malone. Would you bow your heads with me, please? Lord our God, we thank you for the joy of this holiday season. We're grateful for the cool weather, the twinkling of lights, the giving of gifts, and the gathering of family and friends. With the beginning of Hanukkah, many in our community are reminded of God's miraculous provision for those who trust in Him. And with the coming celebration of Christ's birth, His followers remember by the gifts we give and receive of God's blessings toward us. Thank you, O Lord our God, for the blessing of this great institution of healing. What a gift. What a miraculous provision is the quality, heartfelt care provided through the ministry of this healthcare system to so many who come to us in need. Bless now this board and this hospital as we seek to do our part in providing peace on earth and goodwill toward men. These things together we pray. Amen.
Let's say the Pledge of Allegiance together. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call the meeting to order today of the Sarasota County Public Hospital Board. And let me read this announcement. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of their invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. We need approval of the orders of the day, please. We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. Approval of the minutes of the meeting of November 18th. We have a motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. And now we have a treat. Interventional neuroradiology at our hospital, Dr. Daniel Case, and you're going to introduce him, right, Dr. Fiorica?
Yes, I'm happy to introduce Dr. Daniel Case. He's our interventional neuroradiologist. Dr. Case did his undergraduate training at the University of San Diego. He earned a BS in neuroscience, then went on to Johns Hopkins University School of Medicine. From there, he did his internship in general surgery at the University of California, San Francisco, and then diagnostic radiology through the Tufts Medical Program in Springfield, Massachusetts. From there, he went on to do 2 fellowships, interventional neuroradiology at Emory University in Atlanta, and diagnostic neuroradiology through the Harvard system at Beth Israel Deaconess. Dr. Case is here to talk to us about the unique procedures they have available to them in interventional neuroradiology right here at Sarasota Memorial. Thank you.
Thank you. Thanks for letting me talk today. I'll briefly just talk about interventional neuroradiology at Sarasota Memorial Hospital and what it is, and just 2 examples of kind of the bread and butter of what neurointerventional does with some imaging. The purpose of neurointerventional radiology is to provide services of diagnosis, treatment, and clinic for patients with neurovascular abnormalities of the brain, head, neck, and spine. And the procedures are minimally invasive, image-guided procedures of those same areas. Here's a list of pretty much everything that's done in neurointerventional radiology. The first one is diagnostic cerebral head, neck, and spine angiography. That's where we do the diagnosis of the abnormalities. And then treatment for aneurysms, arteriovenous malformations of the brain and spine, tumors. We can do preoperative embolization of tumors of the head, neck, and spine. Epistaxis, that's where patients have uncontrollable nosebleeds or oral bleeds from such things as tumors of the head and neck, as well as just nosebleeds that can't be controlled by ENT. They send them to us, and we can preoperatively, or not preoperatively, we can embolize them and stop them from bleeding from the inside. Angioplasty and stent in the head and in the neck, most commonly carotid stenting when carotid endarterectomy is not possible. Vasospasm treatment. Now, vasospasm is something very specific. It occurs with patients who have bleeding in the head from an arterial bleed, which I'll talk a little bit more about in just a second, where the arteries of the brain start to get irritated, squeeze down, and cause strokes. Also, treatment of strokes for that example, as well as acute strokes from emboli, which are more common. And then vertebroplasty, spine biopsies, and pain interventions are some of the other smaller, shorter procedures. Required for neurointerventional procedures is a biplane fluoroscope, which provides imaging in two separate planes simultaneously. And the reason that's required is that the procedures are so risky to do that even the smallest mistake can be devastating. So it requires a biplane fluoroscope, and newest technology is very important. And just wanted to say that the board approved a brand new biplane that was placed and finished just in July. Amazing. That's on the bottom right is a picture of the biplane system from the control room, where I'm showing different computer systems that are used to take those imaging and reconstruct them into various things for treatment. First example case, this is a 36-year-old gentleman who had the worst headache of his life last Sunday. Came to the hospital and they did a non-contrast head CT that showed what's called a subarachnoid hemorrhage. A hemorrhage in the head that's in the space called the subarachnoid space. That's the space that surrounds the brain and is folded into the brain. And you can see the subarachnoid space right through here. Now the white stuff is actually contrast in the arteries themselves in the brain, but the subarachnoid space surrounds that space. The most common cause of a subarachnoid hemorrhage is actually trauma. But in a case where there is no trauma, the next most common thing is a cerebral aneurysm. The cerebral aneurysms are very dangerous once they rupture. Before they rupture, it's about a 1% chance per year that they could rupture for the average garden variety aneurysm. And about 5% of the population, usually over 50, have aneurysms and don't know it. Now, once they rupture, the patient has a 1/3 chance of instant death within minutes. If they survive that 1/3 chance, they have about half, that remaining 2/3 have about a half chance, or excuse me, 50% chance of that aneurysm rebleeding most within the first 2 days. And if it rebleeds, their chances of death are much higher than 1/3. So the first order of business is to identify the aneurysm if it is there, and then treat it within the short period of time. Now here's a CAT scan, a CTA. So it's a CAT scan with contrast in the arteries. And here you can see the internal carotid artery. This is where my arrow is. It branches into the middle cerebral artery over here, and then the cerebral artery over here. And they traverse into the subarachnoid space and then penetrate the brain to supply the brain. Right here at my arrow, is a aneurysm on the anterior cerebral artery. That's where the subarachnoid hemorrhage occurred. So then what I do is take the patient directly to angiography, that table that I showed you before with the biplane, take a very small catheter from the artery in the leg called the femoral artery, which is a medium-sized artery in the periphery. It's low risk. You access that artery with a very small catheter, guide the catheter with the imaging all the way into, in this case, the internal carotid artery on the right side, and then I inject CAT scan dye while watching. And here you're seeing a spin. So I'm spinning the camera around the patient's head while imaging, while injecting the CAT scan dye at the same time. And this is the internal carotid artery. You can see his eyes are starting to look at us now, teeth right in front of us. I stopped it right at the AP plane to show you the aneurysm. So that's the same aneurysm you saw in the coronal CT just before. So this spin, I take this data and I transfer it to the system outside in that control room that I showed you a picture of. And I reconstruct it in order to figure out what kind of aneurysm it is. I know right off the bat it's a saccular aneurysm. That's a sidewall aneurysm, Berry aneurysm. These are all the same things. And with this imaging, I reconstructed what I just showed you into this. Now I can rotate this in any plane I want. And I stopped it here because you can see the aneurysm between the two second segment of the anterior cerebral arteries. The aneurysm kind of points down like kind of downward, but where that red arrow is, you can see something point straight up. That is what's called a pseudoaneurysm. That's an aneurysm on an aneurysm. That's where the wall really doesn't exist, and that's where the patient ruptured. And it's sealed over temporarily, and that's why he's still alive. Now that's the most dangerous part of the aneurysm. So with that imaging, and you can see up in, let me show you. Top, that blue thing, you see that blue thing on the top there? That's actually a representation of the table and the angiogram unit, the fluoroscope itself. And so I used those two data, the first, the caricature here showing the aneurysm and also the position of the biplane in order to determine how best to get to the aneurysm, how to visualize the aneurysm while treating it. And that's this image right here. So on this image, what you're seeing is two catheters coming through the internal carotid artery from the leg. You can see two distinct catheters coming all the way around. The red arrow is a micro balloon that crosses the anterior communicating artery. That's where the aneurysm is. Anterior communicating being between each anterior cerebral artery. That little balloon, it was necessary because the aneurysm itself had sort of a wide neck. So instead of like a balloon where you have a little pinched off area you can blow into, this aneurysm was just like a little mountain. And that makes it a little more difficult to keep coils in it because they want to just flop out. And if they flop out, the patient has a big stroke. So the red arrow is a balloon that I inflated and deflated periodically in order to keep the coils in. So in the blue arrow, you can see the coils that are being deployed. You can actually see the catheter tip just inside the aneurysm on that upper left corner of the aneurysm. That's the catheter tip. So the coils are coming out of the catheter tip right there into the aneurysm, and they form their own predestined shape. And there's different shapes for different coils. They're made of platinum. And each time I deployed one, I opened the balloon, kept them in, and then deflated the balloon to make sure they stayed. Until finally, on the right bottom is the treated aneurysm. On the left is an example of what we saw already. So you can see that the coils fill the aneurysm completely. The aneurysm doesn't fill at all anymore. And although it looks like it's blocking the artery, it's not. That's just because it's in front of the artery. And this, what it does is essentially it's like filling in a pothole in the road. You fill it in so that blood doesn't get into it anymore. And you take that risk of rehemorrhage of 50% and you put it to 0. So then you concentrate on recovering the patient from the subarachnoid hemorrhage that already occurred, which would be a whole another hour lecture. I won't go over that today. So next example, aneurysms, that's one piece of the bread and butter. The next is acute stroke. There's many other procedures, but definitely not time to go over that. So here's an acute stroke. This patient is an 85-year-old female who was a author and a poet. She has 18 published books. She has atrial fibrillation, which is fibrillation of the atria, and that causes stasis of blood in the heart. They give people Coumadin for that, which is a blood thinner to keep clots from forming in there, because then they can launch and go up into the brain, for example. Well, she had a GI bleed, so you had to stop the Coumadin. They had to admit her, and they did a GI procedure to stop the bleeding. While she's off Coumadin, the next day after the procedure, the nurse noticed she couldn't really speak very well. She just kind of wasn't able to produce the words. Dr. Cohen was her doctor. He immediately recognized that she was having a stroke. Called me immediately. Within 20 minutes, she was downstairs getting a CAT scan. So this is a coronal sequence CTA of her head. And right now, the arrow is pointing at the left middle cerebral artery. In radiology, everything's reversed. See, the left middle cerebral artery comes off the internal carotid artery, right? Comes over like this. My arrows are going to point to an artery that just disappears. Right there. Now it's gone. That little branch right there. By the time she was done with her CAT scan, not only could she not speak, she couldn't understand speech. Her entire left side from forehead to toes was paralyzed. And so we immediately took her from this study into the angiography suite. And by the time we got there, she started having gaze deviation. She couldn't understand. She was basically gone. And so I immediately took a catheter into the femoral artery, went up into the internal carotid artery, which is what you're seeing right here. This is a lateral from the side view. Carotid artery coming up, middle cerebral artery coming out. This is the same as that CAT scan I showed you. Stops right there. That's her stroke. Now, on the left side of the brain, you have language production, language understanding. You have the entire motor and sensory of the right side. And by this point, like I said, she was gaze deviated, which is, she couldn't even look to her right side anymore, let alone understand what anybody was saying to her. So, oh, I skipped it. So I took a very small catheter, see the catheter right here, that white line going up into the internal carotid artery coming up. At this point, I'm right here. But then over a wire, I guided that catheter all the way up to here, and then I took a little syringe and just aspirated. That little chunk on the right came out of the catheter, and that arrow on the left shows the artery back to normal. Now, as soon as the procedure was done, I closed the femoral artery, moved the imaging system out of the way. The patient, I was standing on her right, which she could not look to the right or even understand. She looked at me, reached up with her right hand, which was completely paralyzed no more than 20 minutes ago, grabbed my hand and said, "Thank you." It was amazing. She sent me a thank you letter, sent me a book. It was something. So neurointerventional, right now what we do is we offer consultation services, care with physicians, or completely on my own. It's a 24-hour available service, and it's been full-time since 2013. And I put in front of you my business card and a letter that we sent out to, we're sending it out to most physicians in the region because a lot of physicians don't even know I'm here or we offer the services, so we're working very hard to get that changed right now.
Are there any questions for Dr. Case?
Dr.
Yes.
Case, what is the time frame that you can save somebody's
Yeah, so right now the research supports less than 6 hours.
6 hours?
Mm-hmm.
So if you can get them at the 5th hour, you can
Right.
save them?
Well, sometimes. People have we all have kind of different, what are called collateral flow in the brain. Some people can tolerate a stroke for up to 6 hours. Other people can't tolerate a stroke even more than 5 minutes without having permanent damage. And we do tests initially, the non-contrast head CT, that can tell us that. Yeah. But up to 6 hours is what research supports, yeah.
Yes, Daryl, I think you had a question.
Yes, Dr. Case, this sounds very innovative and magical to me. Is this of your doing, or are you learning this?
This has been around, so interventional neuroradiology was started in the 70s, really. And stroke intervention and coil embolization started in the 80s. Stroke intervention more recent, more like 2000s is when stroke started, really. And that,
Largely you're doing then?
oh, here? Yeah, right now.
No, I don't mean here, I mean overall.
No, there's probably 800 or so interventional neuroradiologists in the country.
Are you having a hard time keeping up with you, are they?
We all have meetings once a year, so.
Thank you very much for bringing your talents here.
You're welcome. You're welcome.
Thank you so much, and this is just fabulous. We
Thank you.
appreciate your presentation.
I just, Dan, Dr. Case, I just wanted to let the board know I think we all know now, but how lucky we are to have him here. He's been here for come stand by me. You're okay. He's been with us here for about a year and a half now, and it's the first time we've had full-time neuro intervention in at least 10 years. And he came along with our new group that we brought in, and just couldn't tell you how happy we are in the community is that and fortunate that we have you here. So thank you for everything. He's very humble. You won't find him talking about himself, Mr. Henry, or anything else. So anyway.
I tried to get him to go, but he didn't go.
He would not do that.
Thank you again.
I just
I'm
wanna-
sorry.
Oh,
Go
I'm
ahead.
sorry. Thank you. I just was looking at your CV and see that you're an Army Airborne Ranger. Thank you for your service as well.
Yes. Yes.
Thank you, Dr. Case.
Since I came up for a second, I just want to say that the hospital staff has been just amazingly supportive. Thank you.
Good. Thank you. And we move on now to an Excel winner for this month, Joyanne Fothauer, Health Information Specialist, Health Information Management.
Come on up. Okay, today I am pleased to announce Joyanne Fothauer is our Excel recipient for the month of December 2014. Joyanne is a health information specialist in the HIM department and has been an employee of SMH since October 1969. Yes, wow. Okay. Positive, professional, meticulous are words that are used to describe Joyanne. And so, Joyanne, I'm going to have some comments here that your peers shared with us on your nomination. An SMHHIM, look, I'm going to share their words, so these aren't mine, okay? Ancient wisdom carrier, okay? I've done this for a while. You saw it? Okay, all right. Okay. Of over 40 years, Joyanne is a...
Somebody for that one.
Yes, I'm sure she'll get them back later. Joyanne is a prime example of an employee who continually goes above and beyond expectations. Whatever the task, she gives it her utmost without complaint. Joyanne is a quality asset to the HIM department, keeping her cool as she deals daily with physician chart completion and suspension process. Joyanne is the encyclopedia of HIM regarding the physicians. You can always ask her a question regarding their practice, partners, addresses, and phone numbers, as well as if they are still active, and she knows the answer immediately. She is meticulous when it comes to assisting physicians with chart completion. She makes sure the medical record is complete according to the guidelines. Joyanne has been in the department for over 40 years and has been through many changes. She's a very loyal employee. Congratulations, and thank you for all you do. Congratulations.
Joyanne, we're receiving the Excel recipient for December 2014, an employee recognition program at Sarasota Memorial Healthcare System. The hospital board and administrative staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of patient stay by making an extra effort in their daily activities. The Excel program is designated to recognize employees who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and image of the Sarasota Memorial Healthcare System in our community. The hospital board and administrative staff are pleased to present to you Joyanne Fowler with the Excel Award for December 2014 in recognition of your demonstrated courtesy and caring attitude and contributions towards excellence at the Sarasota Memorial Healthcare System. Signed by David Verigner, Chief Executive Officer, and Marguerite Malone, Chair, Sarasota County Public Hospital Board. Congratulations.
You get to take it. Would you like to say anything?
Take everybody's body.
Ian, thank you very much.
Joyanne?
And now the report of the medical staff, Dr. James Fiorica, Chief of Staff.
Yes, the Medical Executive Committee has one item. It's a recommendation to create a set of specific orders for beds.
Thank you.
I move approval of policy regarding special orders for bedside procedures as recommended by the Medical Executive Committee.
Do we have any questions or discussion? Hearing none, all those in favor of the motion, please indicate by saying yes.
Yes. Yes.
Opposed? Motion carries. Thank you very much. That concludes your report. Thank you. And the auxiliary report, Dottie Ziegler, Auxiliary President.
Thank you, Madam Chair. Our recording secretary had to step down due to personal reasons very suddenly, and the nominating committee for the board found another volunteer willing to take this position. Lori Gappert was elected by the board at the December meeting and began her new role. Lori retired from SMH and was here for a very long term. and she returned as a volunteer and is working on the courtyard tower. We're very happy to have her, and she will be a good asset to the board. We had a fundraiser on December 2nd and 3rd. We had a very good turnout, and most of the items were sold for $6. It's a very popular sale around Christmas. Employees can purchase things, they have teachers and that kind of thing, so they really like that sale. The board was asked to purchase 4 desk chairs for 8 Waldemere. They were needed for the desk area and were not in the budget for this year. So the board voted to give the unit the requested $1,280 to cover this cost. We want to wish everyone a Merry Christmas, Happy Holidays, and a very safe New Year. That concludes my report.
Thank you very much. And the Sarasota Memorial Healthcare Foundation, Alex Quarles, President.
Thank you, Madam Chair. No report other than thank all of you who were able to attend our 20th Annual Corinthian Society celebration, honoring our newest donors, and recognizing those. And obviously the newest ambassadors of philanthropy, which is the Roberta Leventhal Sudikoff Foundation, for their tremendous gift of $2 million to name the 2 floors at the cardiac unit in the new tower. Other than that, I just want to remind you that our next gala, since we only have one every 3 years, is January 24th. So please get your tuxes and your tickets ready.
Thank you. I think I'll wear a dress instead of my tux. Thanks. The Treasurer's Report, Joe DiVirgilio, Chairman. Treasurer. Did I go right by the secretary? I was still thinking of the tux. Okay, so I'm coming back. We'll have the Secretary's Report, Mr. Tom
Thank you,
Towler.
Madam Chair.
You have to wear a dress too, Tom.
Okay. The January board meetings are as follows. Tuesday, January 6th, 8 o'clock, the board breakfast, 9 o'clock, the Quality Committee, 10 o'clock, the Finance Committee, and 11 o'clock, the Audit Committee. And then on Tuesday, the 20th, we have a 1 o'clock public board meeting. Madam Chairman, that's my report.
Thank you so much. And now to the Treasurer's Report, Mr. Joe DiVirgilio, Treasurer.
We have one item for action today, and that's the motion. Approval of the bad debt and charity care for the month ending 30th of 2010.
Second.
We have a motion and a second. Any questions or comments? Hearing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. And the first operations report, Mr. Bill Wojin, Chief Financial Officer.
Thank you, Madam Chair. I have the financial highlights for November, and this being the month. Second month of our fiscal year. For operating revenues for the system, for the month of November, $46,098,000 compared to a budget of $44,469,000. For the 2 months, $94,564,000 compared to a budget of $90,755,000. The expenses for the system for the month of November, $46,996,000 compared to a budget of $45,901,000. Fiscal year to date, $96,606,000 compared to a budget of $93,527,000. Our operating income in the rating agency format for the system for the month of November, $1,695,000, which equated to an operating margin of 3.4%, compared to a budget of $1,273,000, which equates to an operating margin of 2.6%. Fiscal year to date, we have operating income of $3,298,000, operating margin of 3.2%, comparing favorably to the budget of $2,633,000, or an operating margin of 2.7%. For the hospital's operating statistics, the average daily occupancy at 391 compared to a budget of 362. Admissions for the 2 months, 4,208 compared to a budget of 4,230. Our average length of stay, 4.83, and prior year was 4.46. Fiscal year-to-date surgery cases, 3,105 compared to a budget of 3,040. Births, 576 compared to a budget of 507. Our outpatient registrations for the 2 months, 65,594 compared to a budget of 65,776. And for the emergency care center registrations, 18,089 compared to a budget of 17,737. Our case mix index for the 2 months, for all patients, 1.72, and for Medicare patients, 1.97. Madam Chair, that concludes my report unless there's any questions.
Thank you. Any questions for Bill? Thanks. And so we'll move on to Ms. Jan Mock, the Chief Nursing Officer.
Good
Second
afternoon.
Operations Report.
And I would like to wish all of you a happy holiday season and a happy new year, and also the community. I'd like to start my report under people. And as you see on the picture here of Dr. Kyle Garner, I'd just like to recognize him. If you remember, he was the Physician of the Year in 2013. He, on December 16th, was just a few days from now, he will be recognized and honored at the March of Dimes annual signature chef event. And he is being recognized as a special honoree for his leadership and support of initiatives that contribute to eradicating infant prematurity, such as early elective deliveries before 39 weeks. He has been a tireless advocate for this initiative at Sarasota Memorial Healthcare System, and the March of Dimes is showing their appreciation for all that he has contributed to Sarasota community. And we add that our thanks to Dr. Kyle Garner for his leadership in pushing for evidence-based policies to keep our newborns safe. So we want to thank Dr. Kyle Garner. And I'd like to ask Janice Mearswa and Joan to come forward. I'd like to recognize them both with the board and publicly to the community. As they join us, Janice doesn't like this kind of thing, but I said you just have to do it. Janice Mearswa, as you know, is our emergency room director. She is leaving us to go back to Colorado, where her family is calling her back. She came here 3.5 years ago, and since then she has put many new programs in place and done many wonderful things. But some of the things that she's the most proud of is her decreased length of stay and also increase in patient flow. The patient experience, and I think David will show you, but this month they were at 88, which is the highest we've seen in many, many years. So thank you for all your great work and your teams. Her strong leadership team that she's developed, and a very strong staff that are very dedicated, engaged, and striving for high outcomes. And then her relationship. She said here, of all the places she works, she so values her relationship and her working relationship with our medical director in the emergency room, Dr. Reuben Holland. So she said that it was a real highlight here, and he would say the same. Janice is a very seasoned ECC leader and has made this emergency room so much better than when she came. So although we are sad to see her go, I and the board, and I'm sure the community, want to thank her for all her great work that she's done. And we're losing a great leader, but Colorado's gaining one. So thank you, Janice. So I want to introduce to you Joan Moser, who's going to be the interim director. This was Janice's recommendation. She came here as the manager of Northport, so she's been in our system for a short time. But she comes to us with a lot of experience. She last came from Ingalls Memorial Hospital in Illinois, and she has a vast amount of leadership experience in the emergency room and in hospitals in general. So I want to welcome her, and I know you'll give her support. And she's already, as Janice has her under her wing, she's mentoring her before Janice leaves at the end of the month. So thank you. Janice, did you want to say anything?
No.
I figured she didn't, but I thought I'd give you the opportunity, yeah. And thanks for doing this. I know you don't like this public.
Janice, the board would like to thank you also. We are kept aware of all the improvements in the ER, and we really appreciate all your efforts. Best of luck to you. We'll miss you, but best of luck. And welcome to you. We'll look forward to working and hearing about you.
Under quality, I'd first like to thank Alex for making this opportunity available through the generous foundation funds. But we, last week, 2 days, Thursday and Friday, we had the honor of having a guest come to speak to us about Team Steps. And I think you've heard about Team Steps, but Team Steps is an evidence-based approach to teamwork. And obviously, in a cultural safety, teamwork is always the best way to go. We learned that in the nuclear power plant business and also in the aviation. And Team Steps is a tool that improves the safety to all of our patients and also improves the environment for our employees. Two very, very important things. So we had 13 sessions on Thursday and Friday with Dr. Karen Baum, and she was delightful. She was very well received by the staff, physicians, and the leadership team. She's very well published. She teaches this throughout the country and internationally. And we had leaders, physicians. We had a good turnout from our medical staff. I don't know, Jim, if you want to offer anything. But she focused not only in general about Team Steps, but there are certain high-risk areas. As you know, we started in women and children's, and we're now rolling it out in the emergency room, the OR, and cardiology. And plus, we have certain tools like SBAR, which is how we communicate with physicians, both on the inpatient side and the outpatient side. We had a total of 580 who attended in those 2-day sessions. And as I say, she was a great speaker. She had a wonderful sense of humor, and she brought it down to very operational and simple terms. And we thank Alex, your foundation, and the committee for selecting her to come and speak to us. So, anything you wanted to add, Jim?
No, I thought it was a good turnout by the medical staff, and I think it's well received, and we look forward to pulling it together to improve quality.
I know the medical staff liked that it was evidence-based, so. The last thing, this is Kyle. The last thing I want to share I have two more things, but this pediatric floor, and you've heard about all the post moves from the bed tower, but this is a very important one, and as you know, pediatrics has been located for quite a few years on the Redder Wing. And as we get people out of the Redder Wing, we're very pleased that pediatrics will be moving to 6 Waldemere. And these are just a few pictures of their unit. This is, as you know, it has to be kid-friendly, so here's an aquarium for the kids to look at. On Friday, we did see, they did have an open house for physicians and people who would be caring for patients, and then we're opening tomorrow on the pediatric unit. So I'll show you a few pictures. Here's the nurse's station. You can see where kids would love that lighting there. And this has a high-tech pediatric procedure room, and it has a playroom. And I think some of you already saw the music therapy room what Brian Johnson from AC/DC Band donated. And it has a very pediatric-friendly environment. The last thing is we had a safety inspection for radiation. We have this annually from the state of Florida. And at our annual inspection last week, the surveyor said that he's been surveying for 30 years. And he's never seen an inspection so wonderful as this one. He said that our organization is very organized, we have the right programs in place, and it was the best survey that he's seen. He wanted to thank Sean Pickett, who is our radiation safety officer here at the hospital. He said he's very conscientious, very forward-thinking, and his abilities to manage these departments is just wonderful. So I want to thank Sean and all the team for a job well done. And that ends my report. Any questions? Yes.
Yes.
Thank you, Madam Chair. Just a comment that high-tech treatment room, I want to give some recognition and thanks to the Starlight Foundation, in which we wrote a grant to fund that room, and they deserve recognition for that. Thank you.
Wonderful. Thank you very much.
Thank you. Any other comments? Thank you, Jan. There are no board reports this month, so we'll go on to committee reports. Human Resources Committee, Joe DiVirgilio, Chairman.
On December 4th, the Human Resource Committee met. We had three major items of business. First, we did welcome Dr. Barry Levin, our community member, to the committee. First business item was to review the results of the 2014 CEO report card, the SMART plan. That is the incentive component for the CEO's compensation. Lori Bennett reported on where each of the components in the SMART plan had come out. There were three open items, or actually one open item relative to three individual goals. Three goals there for strategic planning, budget process, and community involvement. David provided us with a summary of his actions and accomplishments in the area. And following discussion, the committee determined that David's performance in each of these were at the stretch goal level. As a result of that, the committee recommends to this board approval of the payment. And as a result, I have a motion. That motion is I move approval of CEO's annual review and payment of 17.24% of base compensation as a SMART Plan Leadership Award for the period of July 1 through September 30th, pursuant to the System SMART policy and based on Mr. Barringer's achievement of the stretch goals set by the board as recommended.
Second.
We have a motion and a second. Any discussion or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
All right, second item that we covered was that we reviewed the 2015 CEO report card and SMART Plan Leadership Board. Just for everybody's reminder, there's really three components made up of the CEO's compensation. There's the merit component, which is targeted at 2%. There's the incentive component, which the SMART plan makes up of, and then there's the possibility of a market adjustment. What that survey next year will determine. Lori Bennett discussed the strategic initiative, discussed with us each of those components, and then we looked at the individual component or individual goals for David for next year, which focus on strategic initiatives, trauma, residency program, legislative matters, and the last item was received a report from management on the various supplemental executive retirement plan options that we were interested in considering. That's the acronym SERP. Bill Wojin presented that to us, and as a result of that, board establishment of a SERP. And as a result, I have a motion. I move to establish the supplemental executive retirement plan as presented to the Human Resources Committee and to authorize the CEO to execute agreements with Principal Financial Group to administer said plan as recommended by the Human Resources Committee.
Second.
We have a motion and a second. Is there any discussion or questions? If not, all those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
That's my report.
Thank you. Move on to mission and planning. Mr. Greg Carter, Chairman.
Thank you, Madam Chair. The Mission and Planning also met on December 4th, and we started with introductions of our new committee members, Drs. Feynman and Brown from the medical arena, and Lim Sharp and James Meister, our community members. Our first item on the agenda was the proposal to purchase some St. Armand's property. Frank Morgan presented this and discussed a proposal to purchase property on St. Armand Circle at 500 John Ringling Boulevard with available parking at the site. The building is on a corner and has great accessibility, and a map of the SMH network was presented, and the new location will complement the system's network. Jen Storch then discussed the property highlighting access to the building from the circle, placement on the circle, covered parking, visibility, and signage. It's hoped that this location will capture the tourist market as well as Plymouth Harbor, St. Armand's, Longboat, Lido and Bird Keys, and west of the trail mainland neighborhoods. It will be part of the due diligence process to look at renovation versus demolition, furniture and equipment and services to be provided at this location. It will have the branded look for SMH, and services for this location will include, of course, the urgent care center, lab draw, and anticoagulation clinic, and x-ray. After the due diligence is complete, they will put together a full project plan and bring that back to the committee for funding that construction. At this time, I move approval of the purchase of the property located at 500 John Ringling Boulevard for the purchase price of $3.6 million as recommended by the Mission and Planning Committee.
Second. We have a motion and a second. Any discussion or questions? All those in favor, please indicate by saying yes. Yes. Opposed? Motion carries. Thank you.
Next, we discussed the graduate medical education residency, and Dr. Steve Taylor reviewed the potential for development of new residency graduate medical education program with the FSU Medical School. He provided background information and program requirements. The FSU Medical School currently sends third and fourth year medical students to SMH for rotations. Dr. Taylor discussed the academic medical center versus teaching hospital and reviewed key program requirements such as hiring of a program director and identifying medical staff faculty. Dr. Taylor provided a timeline of the program, which includes development of an affiliation agreement, a search committee to establish a program director, accreditation for the program, medical program applications, recruitment of facility, identification of potential residents, and the first graduate medical education residency class timeline. Impact on patient care was discussed, and benefits to the institution, funding payments, and next steps were also discussed. Excuse me. And the last item on the agenda was the Percy study, and Peter Taylor discussed the survey of consumer protection in the primary, secondary, and tertiary markets. This is the annual consumer perception study. We have had amazing results with this, and Peter discussed the methodology advising that instead of phone calls, surveys were printed, and surveyors used a booklet and went door to door and collected the papers the next day. We had good success with this method, better than phone calls. Service area definitions were provided, and Peter discussed the key aspects of the study. He advised that we improved in every single service line, and some of this may be due to the momentum with the opening of the new courtyard tower. And that concludes my report, Madam Chair.
Thank you. And everything is very important, but the board, I think, has really resonated a lot with the new residency program. So we want to take this opportunity to publicly thank Dr. Taylor, Dr. Fiorica and David Verinder for all of their work toward that end. It's really exciting. Thank you. And now we move on to the President's report. David Verinder, President and CEO.
You want to look at quality, Margaret?
Excuse me?
Quality?
I was hurt.
This is not my day. I really, it's time for the
It's
Christmas
teamwork, Dr. Malone,
holidays,
it's teamwork.
really. Okay. I do apologize. It's going to be particularly funny when we hear what Bob has to say. And now the Quality Committee report with Chairman Bob Strasser.
Thank you belatedly, Madam Chair.
Nice shot,
The
Bob.
Quality Committee meets in closed session. I have nothing to report.
Thank you. And now we'll go on to the President's report.
Thank you, Madam Chair. I just didn't want to, I knew Bob likes to give that piece of his report, so. I'm going to start off today with our leader report card that we look at for the system every month. And we're going to start in our service pillar. We look at our HCAP score, which our goal is to hit 9 goals at the 50th percentile or above, and I'm happy to report that year-to-date we are at 9 goals and above. On the outpatient side, we have a goal of hitting 83rd percentile, and I'm happy once again to report for the year-to-date we are at 84th percentile. In the people pillar, our merits on time, we have a goal of 95%. We are a little bit low on that. We're at 89% on time. Certainly need a little bit more attention on that, but there were some holidays during the month of November, and so we had some people out and unable to do that. Turnover, we have a goal of 16% turnover, and I'm happy to report that we're under that, and we have a 12% turnover year to date. In the quality pillar, our organization percent of patient safety readiness, our goal is 95%. And I'm happy to report that we are continuing to trend higher than that. We're at 99%. Our infection prevention, which is the combined overall standardization infection rate, we have a goal of being less than 0.95. And I'm once again happy to report that we're meeting that or exceeding that at 0.87. In finance pillar, which Mr. Wojciak already reported on, we have an organizational finance goal of having a 4.4% operating margin, and I'm happy to report that we're trending to hit our 4.5%, so pretty much right on top of that one. In the growth pillar, the first goal is inpatient admissions. We have a goal for the year of hitting 26,308 admissions. We are trending a little lower than that. We had a little bit slower month in the month of November, and our trend now is to hit 25,400. But I'm happy to report December seems to be quite busy so far. And in outpatient registrations, we have a goal of 755 registrations. As the board may remember, we rebased this without lab registrations. That's why the number may be a little bit lower than what you remember. And I'm happy to report that our score is 658, 604, so we're just over that threshold. Looking at our HCAP scores, a little bit more detail. What we have here is we're showing the trend line from for September, October, and November. So for the month of November, I'm happy to report that we hit 10 out of 11 of our HCAP scores at the 50th percentile or better. Only missing responsiveness to hospital staff, but I'll trust me in the fact that our teams are working very hard on that under Jan's leadership. Year to date, as I reported earlier, you can see in the bottom right-hand corner, we're at 9 out of 11. Looking at our likelihood of recommending on our outpatient side, our goal, this is year-to-date numbers, as I reported, our goal is the goal is the 83rd percentile. I'm not sure why it says 85th, but we are actually at the 84th, so we're 1 point above that. We continue to see good reports from quite a few of our operations, and those even in the far left-hand side continue to improve. Moving on to people. Almost 40 Sarasota Memorial corporate volunteers assisted with All Faiths Food Bank's Bowl of Hopes this past month. Along with providing funds for the food bank, the annual event also raises awareness of the problem of hunger in our community. In addition to its volunteer team, the hospital's food and nutrition service also donated one of its specialties, red pepper and Gouda bisque. So thank you to all of our teams there. We're very well. Keeping with All Faiths Food Bank, we also did our turkey dinner distribution. SMH physicians, staff, and family members, along with area residents, volunteered Saturday, November 22nd, to help All Faiths Food Bank distribute turkey dinners to those in need in our community. So once again, thank you for all of our staff, physicians, and volunteers who helped with that. Moving into people. The USF College of Nursing launched its third annual BEARS, which is Bulls Encouraging and Assisting Through Research and Scholarship campaign at SMH last week. The custom teddy bears dressed in matching 2014 USF nursing uniforms were hand-delivered by more than 100 students, faculty, staff, and alumni to pediatric patients and parents of hospitalized children at SMH. So thank you, USF and the Bulls. The next is under our quality and safety, and this is just a calendar look at our Health Fit organization, and just wanted to give the community an idea of all the different things that go on in this in Health Fit each and every month, from classes on nutrition to different exercise programs, and we certainly welcome out anybody out to come out and experience our Health Fit folks and staff. Staying in quality and safety, I'm happy to report that Sarasota Memorial's Comprehensive Rehab Unit has received a 3-year accreditation by the Commission on Accreditation of Rehab Facilities, or CARF International. Both the inpatient adult rehab as well as a stroke specialty program are now accredited through December 2017. This achievement is an indication of SMH's dedication and commitment to the practice excellence and improving of the quality of lives of our patients. CARF will recognize this achievement in its listing on organizations holding accreditation, and I'd just like to make sure we all thank Maria DiCarlo and our CRU team for the great work that they continue to do in and out. And I will tell you, this is a monumental thing that she undertakes and leads for this organization. Next, under quality and safety, this is an article that came out in Herald Trib, and who you see there in a picture is Dr. Adam Bright, who's one of our orthopedic surgeons on staff. It's a great article. I'm sure you can't read it on your screens. This is extraordinarily small type here, but that's how in breadth the article was. But Dr. Adam Bright volunteers with SMH's Community Medical Clinic and is part of Operation Walk USA. Operation Walk provides hip and knee replacements for patients who can't afford them. Through this program, Dr. Bright has donated his time and performs 3 surgeries at SMH during the week of December 1st. And we just want to thank Dr. Bright for everything he's done, both this and everything else on staff. And I do want to draw your eye to, and once again, I know you won't be able to read it, but you'll be able to see the graph in the bottom right-hand corner. And I have circled the SMH, Sarasota Memorial Hospital, basically cost to do a knee. And it gives the cost per organization throughout the region, and you will notice that we continue to be the lowest cost provider, as well as being able to brag that our quality is some of the highest in the nation. So just wanted to make sure we all saw that. Looking at the section on growth, Mr. Carter reported in his in mission and planning minutes that the board has now approved the purchase of the St. Armand's property on St. Armand's Circle. We're very excited about this. This is a picture of the current building. We will certainly are going in and doing our review on whether we renovate the building or do something else with it. But our intention is to open up a new urgent care, our 6th urgent care center, and serving all the communities in and around St. Armand's, including Longboat, Lido, Plymouth Harbor, Bird Key, and anyone else that I've just failed to recall.
St. Armand's.
St. Armand's itself, yes, of course. So we will be analyzing the services that we were able to put there. We got some great feedback from our medical staff on some different types of diagnostic tests that would be very helpful to have in that general vicinity, and we're working towards that. And with that said, I would just like to wish everyone a happy holiday season on behalf of the administration at the hospital and the health system. So any questions, I'd be glad to answer.
Any questions for David? Thank you very much.
Thank you.
We have nothing on the consent agenda. Do we have any, no public comments? Legal matters? And Kayla?
I have nothing to report.
Okay. Other business? Just on behalf of all the board members, we'd like to wish staff, physicians, administration, and the whole community a very, very happy holiday season. And it's been a good year. So with that, meeting's adjourned.
It was a straight, and I was writing him this note. He was trying to read it at the same time.
Yeah, nothing like having everybody try to, help.
Well, you know,
Thanks, Tom.
Derek,
Thank you guys. That's good.